A blow to the head that shakes the brain, whether from a sport, a fall, or some other accident, is something to take seriously. A concussion is a type of brain injury and causes temporary changes in the way the brain works, and you don't want it to happen more than once.
If you're experiencing symptoms of a concussion and you take another hit to the head, your symptoms can get dramatically worse. And I've had kids who were doing well, but then took a second hit and became basically dysfunctional at that point, have had to drop out of school, go on homebound. So preventing that second hit is very, very important for us as medical professionals.
Concussions are taken very seriously at Spartanburg Regional Sports Medicine Institute at Upward Sports Center and at North Grove. Patients are regularly sent to the concussion clinic at the Sports Medicine Institute for an evaluation of a head injury.
I'm going to go in, I'm going to do a neurologic exam to make sure that they don't have something more than a concussion, like a head bleed. If so, then I'm going to potentially opt for some neuroimaging, like a CT scan. Once we rule that out, we'll put them through some other things. We'll have them do some balance tests, some memory tests. I want to try to gauge how their brain is working and functioning.
Doctors then come up with a treatment plan to get patients back to school or work.
I think of symptoms from a concussion in 4 different boxes or categories, if you will. I think of physical symptoms, so nausea, sometimes there's vomiting, vision disturbances. I think of cognitive issues, but more of how the brain is functioning. Do they feel slowed down and foggy, trouble laying down new memories? I think of sleep disturbances, so sometimes people's sleep will be thrown off. And then finally, we think of emotional disturbances. So sometimes, especially like in the younger kids, their most prominent symptoms will actually be a change in their personality.
As part of a research project, Dr. Lucas is looking at how concussions affect driving and reaction times. With this specialized driving simulator, patients who have suffered a concussion are put through driving performance tasks. For example, it measures how hands react with the steering wheel or how a foot reacts with the pedal. There are different tasks that are needed for people to be able to drive, and they have to put all those together to really be a good and safe driver.
We've had about 4 patients go through our driving simulator after their concussion, and what I can tell you from the staff that's giving them these tests is that they are markedly slow in their reaction, in their foot pedal reaction times. It can make them more symptomatic. They have trouble concentrating and focusing on these tasks. And to me, that's very troubling information, knowing that these kids are potentially behind the wheel out there. And I think we need to investigate this a little bit more.
The best diagnosis and treatment for concussions with sports medicine specialists at Spartanburg Regional Sports Medicine Institute.